Share screen and we will try it again. No, está viéndose lo mismo que tú.
It's binary.
Vale, ok. So,
It's working now.
con presentación, ¿no? Ya está.
Okay, yeah.
Yes.
It's working now.
Yes. In the notes. ¿Ah? No, es que hay que darle a esto, ¿eh? Un momento. Okay. Compartir. And now we take this.
Screen two.
Yes, screen two. I think. Yes. Okay.
Thank you.
Wow. Qué bien.
Necesitamos un guionista.
Okay, sorry for this break. We are ready now. Okay, ready everybody? Okay, so as we saw, to portray individuals with disability in a respectful and balanced way, to do it, we must use language that is accurate, neutral, and objective. So important aspects we need to consider are as to find out if an individual is willing to disclose their disability. Don't assume that people with disability are willing to disclose their disability. While some people prefer to be public about their disability, such as including information about it in a media article, others choose to not be publicly identified as a person with disability. Emphasize abilities, not limitation. This is very important. Choosing language that emphasize that people can do instead of what they can't is this is empowering. For example, use person who uses a wheelchair instead confined to a wheelchair, or person who uses a communication device rather than is non-verbal. She or he can't talk. Refer to the person first and the disability second. People with disabilities are first and foremost people. Labeling a person equates to the person with a condition and this can be respectful and deshumanizing. A person is not a disability, condition or a diagnosis. A person has a disability, condition or diagnosis. This is called person-first language. For example, we must use person with disability, people with disabilities, men with paraplegia, or a student receiving special education services, rather than disabled person, paraplegic, or special education student. However, always ask to find out an individual's language preferences, because people with disabilities have different preferences when referring to their disability. Some people see their disability as an essential part of who they are and prefer to be identified with their disability first. This is called identify first language. Others prefer person first language. So it's very important to ask. For example, I prefer person first. I consider myself as a person with disability, not a disabled person. Use always natural language. Don't use that portrays the person as passive or suggests a lack of something, like a victim or an invalid or defective. This is horrible. Use language that emphasize the need for accessibility rather than the presence of a disability. Use accessible parking or accessible restroom rather than handicapped parking or disabled restroom. Do not use condescending euphemisms. Terms like differently able, challenged, handicapped, capable, or special are often considered condescending. Do not use offensive language. Examples of offensive language include freak, retard, lame, imbecile, vegetable, cripple, crazy, or psycho. Maybe this seems very obvious, but I think it's important just to make sure everybody we are on the same page. When talking about people both with and without disabilities, do not use words that imply negative stereotypes of those with disabilities. For example, don't refer to people without disability as normal. That is very typical too. Or able-bodied. Remember that disability is not an illness, and people with disabilities are not patients, not always are patients. People with disabilities can be healthy, although they may have a chronic condition, such as arthritis or diabetes. Only refer to someone as a patient when his or her relationship with a healthcare provider is under discussion. Portray successful people with disabilities in a balanced way, not as heroic or Superman. This is very important too. Do not make assumptions by saying a person with disability is heroic or inspiring because they are simply living their lives. Stereotypes may raise false expectations that everyone with a disability is or should be an inspiration. People may be inspired by them as they may be inspired by anyone else. So not just because a person has a disability is a hero. Maybe he or she is, but not just because of disability. And here there are some references of guidelines of inclusive language to communicate with or talk about people with disabilities. As the Disability Inclusive Language Guidelines from the United Nations, the guidelines for writing about people with disabilities from the National Network Information, Guidance and Training on the Americans with Disability Act, and the Disability Language Guide from the Stanford Disability Initiative Board. As you are going to have all the slides, you can access to these links. And now we are going to talk about how to interact or communicate with people with disabilities. So first, talk to persons with disabilities in the same way and with a normal tone of voice. So maybe you remember the video from yesterday that one person, what was the situation? One person was asking about an address, and the other person was like, Lainey, yeah. So, yeah. Avoid being self-conscious about your use of wording such as, do you see what I mean? All the time. When talking with someone with vision impairment. Talk to people with disability as adults and talk to them directly rather than to the accompanying person. Ask the person with disability if assistance is needed. Do not assume that help is needed until you ask. Well, use people first language or ask the preference of the person. When communicating with a person with disability, it's important to take steps to ensure that effective communication strategies are used. This includes sitting or standing at eye level. The patient, sorry, with the patient, no, this is wrong. To make appropriate eye contact. And here are more references about this. So thank you very much for your attention. Any question? Thank you so much. Thank you.
See you.
Hello, how are you?
Hi, thank you.
I want to how you can present your presentation as well, and another talk. You are present the presentation and you are talking. Okay, when you are present the slide, you are talking. I want to see presentation how you can put the words in the presentation.
Yeah, so my words in the presentation,
Yes,
I know.
I know if you want go back to your presentation.
Yes.
Okay, and